Hello, this is Gina Proctor. I'm the Director of School Health. We are going to discuss health issues with Lampasas students. We will talk about health alerts and different disease managements. Skyward Health Indicators. Campus nurses will be putting information into Skyward. If there is a little red message box here, you can click on this and it will give you medical information. Also, these numbers and letters over here indicate if the student has an IHP, they're 504, they have a medical condition. It's your responsibility to review these. Individual health plans, IHPs. These are created for students with medical conditions that require medical care or monitoring while at school. The campus nurse will provide all teachers with a copy of the IHP. They can also be viewed in Skyward. The nurse will provide any training that you need in regards to the IHP. All IHPs have some sort of documentation that must be maintained. Asthma. Lampasas has over 200 students with documented asthma. Statistics show that 13 million school days are missed each year due to asthma. What we can do to decrease the absentee is keep our classrooms clutter-free and limit items that collect dust, like stuffed animals, feathers, pillows. Avoid using fragrances or scents and deodorizers. If you have to use them, plain vanilla or peppermint is best. But if a student or staff member is having asthma attacks due to these fragrances, you will be asked to remove them from your room. Limit the use of perfumes and body sprays and encourage students in your class to do the same. Send students to the nurse for asthma when they must talk in short sentences using 1 or 2 words. For example, I can't seem to catch my breath. And this is not due to exercise. If they have persistent coughing that sounds tight, or you can hear the audible wheezing. Of course, blue tinged around their mouth or nose is always a bad sign. How we treat asthma is with an inhaler or nebulizer. State law permits students to carry their inhaler with them at all times. If a student is having exercise-induced asthma, sometimes all they need to do is rest. Diabetes. We have 10 students with insulin-dependent diabetes. Diabetes is a disease where the body doesn't make or properly use insulin. Your body either doesn't make any insulin at all, it only makes a little bit of insulin, or it makes all the insulin you can use, but your body doesn't use it properly. The goal to manage diabetes is to keep the blood glucose level even. It's a constant 24-hour, 7-day-a-week juggling act between insulin, exercise, and food intake. Hypoglycemia, or low blood sugar, is the greatest immediate danger. It's not always preventable, and when your blood sugar is low, it impairs your cognitive and motor functioning, which means if you have a student with low blood sugar in your class, they're not learning what you're teaching. Early recognition and intervention can prevent an emergency. Possible causes of low blood sugar are too much insulin, too little food, or too much physical activity. The signs and symptoms can range from hunger, shakiness, a student may just say, I don't feel good, to confused, they'll become irritable, they can be unresponsive, they can even have a seizure. What you need to do for hypoglycemia is intervene promptly. Have a student escorted to the clinic. Never send a diabetic student that doesn't feel good alone to the nurse. Either send them with another student or a staff member. If the student doesn't have their glucometer with them and you don't know what their blood sugar is, you still treat. If they're feeling like they have low blood sugar, they probably have low blood sugar. Do not give a diet soda. Routine is the key for management of diabetes. You need to consult with a parent or guardian if a snack time, a meal time, or exercise times change. Monitor blood glucose variations on gym days. Sometimes they may need an extra snack 30 minutes before gym. And like I said, a student with low blood sugar should never be unattended. Practical implications for teachers. Allow every diabetic student to be able to have access to snacks during class. They have the right to test their blood sugar during class. State law permits students to carry medication and glucometer with them at all times, and they need to have unlimited access to water and bathrooms. Allow students who have a low or high blood sugar to be able to make up work that occurred during the incidents. Seizures. There are many different types of seizures, but today we will be discussing tonic-clonic, which are also called grand mal seizures. These are convulsions, shaking, jerking. These are what you see on television. Also absence or petit mal. These are the blank stares. It looks like the student may be daydreaming. Basic seizure first aid. First and foremost, stay calm. Notice the time that the seizure began. Remove other students from the seizing person. Keep student and safe members safe. Don't restrain or put anything in their mouth, and you stay with them until they're fully conscious. Then we will record on a seizure log. Not all seizures are an emergency. If a student has a history of seizures, they may have them often and it's not an emergency. But a true medical emergency for a seizure is someone that has never had a seizure before, or if they have repeated seizures without regaining consciousness, if a student has injured himself and then seized, or you have a diabetic student that is seizing, or a convulsive seizure that lasts longer than 5 minutes, or a student has breathing difficulties, or a seizure has occurred while in the water. Automated external defibrillators, AED. This is a device that shocks the heart to restore a normal heartbeat after a life-threatening irregular rhythm, including sudden cardiac arrest. Why do we need these in the school? It's all about time. Every minute that defibrillation is delayed, survival decreases by 7 to 10%. If defibrillation is delayed by more than 12 minutes, you have less than a 5% chance of survival in adults. Also, it's the law. It's your responsibility to know where the AED is at your campus. The high school has one in front of the library, between the gyms, and in the field house. Middle school has one in front of the cafeteria and in Bozarth Fowler Gym. Klein Whitus is across the hallway by the principal's office. Hannah Springs is across from the nurse's office. Taylor Creek is across from the cafeteria by the gym. There's also an AED at the hub, and there's one at the old Lampasas Middle School new gym. How do you use them? The most important step in using an AED is just to remember to get it. If you will get it and turn it on, it will tell you exactly what to do. It will tell you how to attach the pads. It will tell you if a shock is advised or if it isn't, and it will even help you do CPR. Severe food allergies. Most common allergy is to peanuts, although we do have students that have tree nut allergies. All campuses at Lampasas ISD are peanut tree nut safe campuses. We don't advertise that we're free of peanut tree nut because we can't control what people bring in. We do encourage staff and students not to bring peanuts or tree nuts to school. But if a student or a staff member needs to eat peanuts or tree nuts, that's okay. We just need to make special arrangements to keep the students that have allergies safe. All tree nuts and peanuts have been removed from the cafeteria. What is anaphylaxis? Anaphylaxis is a severe allergic reaction that can be life-threatening. It must be treated immediately. The drug of choice is epinephrine. We're going to talk about the signs and symptoms of anaphylaxis, and we're going to learn how to administer epinephrine. What is an allergic reaction? Exposure to the offending food or allergen may trigger the sudden release of chemicals, including histamine, which results in symptoms of an allergic reaction. The symptoms can be mild or severe. They can progress over minutes or even take hours. Common allergens include bee stings and latex, and of course food allergies. These are the 8 most common food allergies. Allergic reactions. There are 3 types of reactions. an ingested, which is the most easily treated, a contact, which means I eat a peanut product, I don't wash my hands, and I touch the doorknob, and then as long as hours to days later, a student that has a contact allergy touches that door handle, they can have an anaphylactic reaction. Or inhalation, which is the most dangerous to treat. A student can just smell peanuts and go into anaphylaxis. We do have 3 students in the district that have inhalation. You need to know who to talk to help, know the signs and symptoms of anaphylaxis, and become familiar with the student's IHP. State law allows students to carry EpiPens with them at all time. When a student has been exposed, you need to remove the student from the allergen if possible. Watch the student, assess for symptoms. If he or she starts to go into anaphylaxis, you need to be able to administer the epinephrine without delay. Anytime you give epinephrine, you have to call 911. Epinephrine only lasts in the body for 5 to 20 minutes. And as an example, ibuprofen stays in your system for 6 hours, but epinephrine wears out very quickly. So sometimes a second dose is needed. Allergy management. Teamwork is vital. Everyone should be aware of students with allergies, from the classroom teachers to the paras to transportation, custodian, food services, everyone. Signs and symptoms. It could just be as little as an itchy mouth, then they start to get hives, they can have nausea and discomfort, then it can go into more severe symptoms which are anaphylaxis, shortness of breath, they start wheezing, they have a repetitive cough, they feel faint, they have obstructive swelling, which means their tongue and our lips swell. How will I know what student has an allergy? The district nurse will develop an emergency care plan for students with a diagnosed allergy, and then the campus nurse, just like with IHPs, will notify in Skyward and inform the teachers. You should review this plan often so you'll know how to act in case of an emergency. Epinephrine administration. Epinephrine is a drug of choice for anaphylaxis. This is a natural hormone that is already present in our bodies. It's also called adrenaline. It's released during the fight or flight syndrome. It should be administered promptly when anaphylaxis is suspected. A delay in treatment can have devastating effects. Now we're going to learn how to give the EpiPen. This is an EpiPen trainer. Every campus nurse has some for you to practice with. The trainer is in blue. A real EpiPen will be in orange or green. You will just follow the steps on the EpiPen. You will remove the blue safety release, hold it in your hand, and you will go mid-thigh. It will go through close until you hear a click. You hold for 10 seconds to make sure all the medication goes in. Pull it out, rub the site, and discard. Then call 911. Thank you. Review. If a student has symptoms of anaphylaxis, you need to follow the IHP. Call the campus nurse if available. Be prepared to give epinephrine if needed. Call 911 and then contact administration to call the parent. Do not leave student alone. Document and debrief. We will have a meeting with the campus nurse, the district nurse, anytime epinephrine is given to review our policies and procedures. Today is the day you learned how to save a child's life. With teamwork, we can have a fun and safe school year. Thank you.